conference title is APA, Global Partnerships and COVID-19. Todos somos familia. I just would like to highlight this particular title because I commend my colleagues for managing the title that way. And the reason for that is because it's an inclusive title. During the last weeks, I share with all the membership evaluation of our interviews, APA SIP in Cuba. And those elements from those interviews show concerns about the relationship. I hope that we will have time to talk about that today. But I can tell you, when I saw that title, it became obvious to me that we are looking at a collaborative platform. And we have two persons who are talking about these partnerships. And the first one is Dr. Sandy Shulman, who's the current APA president. The second one is Dr. Jennifer Kelly, which is the president-elect. She will become the active president next year. And they are both here. So let me introduce them officially. Dr. Shulman is managing partner of the Columbus Office of Executive Development Group, LLC. She's internationally known in leadership and executive assessment and development and manages large and long-term organizational clients for the firm. She teaches leadership at the HEC School of Business for their EMBA and MBA programs in Paris, Doha, Beijing, and Shanghai, and has also served as faculty for the Duke University Fuqua School of Business Global Learning Network. Her organizational work experience has focused on leadership and executive development, executive coaching, strategic planning, and multicultural and diversity initiatives, working with major global organizations and leaders. She is co-author of Performance Appraisal on the Line, a groundbreaking book on performance evaluation, and has written numerous articles and book chapters on significant organizational performance issues, including foundational work on sexual harassment and hostile work environments. Her most recent publications have focused on leadership in ambiguous and uncertain circumstances, the emerging challenges facing global leaders, and the role of psychologists as learning leaders. Dr. Shulman holds a bachelor's degree in mathematics from Dixon College, a master's degree from Harvard University, and her PhD in counseling psychology from Ohio State University. Previously, she served as founding faculty in the Cleveland State University Diversity Management Program and lectured and facilitated leadership development program for over 15 years at the John Glenn School of Public Management at the Ohio State University. She served for 17 years as president of a behavioral healthcare organization called Organizational Horizons, Inc. Prior to that, she served as faculty and acting director of the Counseling Psychology doctoral program at Kent State University and director of Managerial Effectiveness Program for the Center for Creative Leadership, where she worked with numerous research projects and leadership development programs. She was awarded the 2012 National. So I can tell you, she, as you all get this information, she has a large and solid curriculum. Let me, for the sake of time, introduce Dr. Kelly, and so that will become then the next. Do you mind, Dr. Shulman, if I skip part of your...
Absolutely. Go ahead. Thank you. Go ahead.
Thank you.
Go ahead.
Dr. Jennifer Kelly is a licensed psychologist and is board certified in clinical health psychology. She is the director of the Atlanta Center for Behavioral Medicine with expertise in disorders that involve the relationship between physical and emotional conditions. She currently serves on the APA Board of Directors as recording secretary. She is past president of the Georgia Psychological Association and Division 31, and past chair of the Board of Professional Affairs and the Association for the Advancement of Psychology. Dr. Kelly has received numerous awards, including the 2012 Timothy Jeffrey Award for outstanding contributions to clinical health psychology, in 2011, the APA Leadership Award, and in the APA Diversity Award. In 2000, the Association 2004 APA Practice Organization Federal Advocacy Award, and in 2006, Outstanding Psychologist Award from Division 31. She has numerous publications, including including articles in psychotherapy, theory, research, and practice, behavioral sciences and the law, pain digest, and comprehensive review book for pain medicine and practical management of pain. So with this note, let me introduce to you the one and only Dr. Sandy Schulman, and she will, after her presentation, introduce the one and only Dr. Jennifer Kelly. Sandy, we are ready for your PowerPoint and your presentation. We can see it perfectly okay.
Thank you, sir. Thank you so much. Hola, buenos dias. I am so grateful to Carlos Zalaquet and other psychology leaders in Latin America, especially those of my colleagues who have been part of the Global Psychology Alliance. United States Psychology and the APA are clearly part of the domain of the SIP. And my message today is a very simple and important one, which is todos somos familia. We are eager at APA to be a strong partner with Latin America. We're all family. We have much in common. The more we can work together, the better we will be as the Americas. So I am so grateful for the opportunity to participate here and to strengthen our relationship and to be part of the first virtual Congress of the SIP. APA and the SIP have had a positive, productive, collaborative working relationship. In 2018, Jessica Henderson Daniel, APA president, signed a memorandum of understanding with the SIP. This was followed in 2019 by our president, Rosie Phillips Davis, attending the SIP annual meeting. She gave a keynote address. She shared psychological science on poverty because APA is committed to those issues of equity that are important and so critical across the Americas. Now in 2020, we are here hoping to cement that relationship. In normal circumstances, I would be with you in person today. We are grateful, however, for the opportunity to work together to combat the COVID crisis. Our communication channels have become much more direct, ironically, resulting from the fact that we had to work together virtually this year. It involved more people and more intense interactions, and it created more increased trust and better working relationships. What I can say now is that Carlos and I are colleagues and friends, not just organizational representatives. This makes so many things possible that we can do together. The challenge of COVID is something that I'd like to talk about today, now that I've laid the foundation for the importance of the APA-SIP relationship. This is what I would like to talk about. The challenge, how APA has responded, and a little bit about my leadership learnings as a person who studies leadership and must now do leadership, and what I have learned through this crisis that I hope might be helpful to you all as well. First of all, what I would say, and I think is pretty obvious, is this is not the year I anticipated happening as APA president. We were moving along in the early year of 2020 to work initially on follow-up to the climate change conference in Lisbon in 2019. We were doing our work at APA to form a very important task force, which we have done, by the way, but we were working on that. We were doing a lot of work on US immigration issues, as you well know, which has become such a major contentious issue in the United States. And then in March, along came COVID. A very short story, on March 10th, Tuesday, March 10th, we had a big conference in Washington for our practice leadership. It's an annual conference where our leaders in practice go to our Congress to lobby for issues that are important to the public and to psychology and psychologists. We were wrapping up that conference as the COVID crisis finally hit the United States reality, and Washington, D.C. was trying to figure out what they were going to do. Our primary focus initially that day, of course, was to get our 350 participants back to their home states and to think about what our next steps were. On Wednesday, March 11th, our CEO, Arthur Evans, and myself made the decision that we would try a test to see if APA could become a virtual organization. The test was conducted on Thursday, March 12th, and the APA, the American Psychological Association, has never been back in its building since. We have been a virtual organization since March 12th, 2020. We are continuing that process and will remain virtual per an announcement this week through June 30th, 2021, at least. We do this because we have critical priorities that we initially identified to base the work of the APA during the COVID crisis. And these priorities have lasted all the way through our response. The first one is to make sure, first and foremost, about the safety and health of our staff, and then directly related to that, of course, that health and safety of our members. So that's why we have remained a virtual organization. Secondly, we wanted to identify and facilitate getting resources and support to our members and psychologists, both nationally and around the world, so that we could provide needed things for help to the public. We aren't large enough and we aren't broad enough that we can directly provide the services ourselves. So we wanted to support our members and psychologists in general across the world. And third, and perhaps most important, our priority was to make critical contributions via collaboration with both national and international partners. And because we knew that if we could distribute the resources we had to those critical partners, that would maximize and leverage the impact that APA could have. So that was our strategy going forward. The other thing that we had that we were very fortunate to have was in the 2 years prior to the COVID onset, we had been working on a very important strategic planning process, and we had a strategic plan. And I can tell you as a leader, every day, I'm so grateful for that, because the decisions that our CEO, our board, our governing bodies, and myself have had to make this year have all been based on the mission, the vision, the values, and the goals and the operating principles of that strategic plan. And if we didn't have that, we would have been missing kind of our guiding star for where we go in this process. And those 4 critical goals that we had, which have a lot more detail, remain the same. What changed in our process was the context of COVID. We had to now implement our strategic plan through COVID and not just in the environment that existed prior to COVID. So the first goal about working to make a positive impact on critical social issues, we were already working on immigration and climate change, but we added to that almost immediately a focus on health inequities, racism, economic disruption, and poverty. In terms of preparing for the future came to get us actually through COVID. So we had immediate work on telehealth and the integration of technology into the delivery of treatment and services for people. And we had to do very rapid preparation. And the APA, for example, prepared 35,000 psychologists to use virtual technologies in a matter of weeks. The third goal for us was elevating the public's understanding and use of psychology. This is really important because not just in the United States, but across the globe, policymakers and the public don't really understand the full range of what psychology can do. Some people are familiar with our ability to provide direct mental health treatment. Some people are familiar with our scientific and laboratory research on people and systems. But we also do so many other things, as you may well know, from sports psychology to creating organizations that become future workplaces, to dealing with automobile safety through space travel design. And it is important to us that the public and the policymakers, both nationally and globally, understand the full range of what psychology can contribute to the world. And number 4 was our strategy to strengthen APA's voice for psychology, so that we could translate our science and our evidence into behavioral change strategies that make a great difference during COVID, around climate change, around racism. And so we wanted to have more public impact through the media and through a public policy. And that was the goal. That's why our strategic plan is called Impact. We wanted to heighten our impact. So our national response focused on several things. A very primary part of that was advocacy. I've already said we did a lot of work in telehealth and technology related issues. We also did a lot of work on national data collection on health disparities to inform our prevention efforts and our response efforts. And this included working with our existing government administration to try to link existing databases so that we could collect data that could target better, more effectively, and more uniquely the needs of specific communities with different cultural needs. We conducted many webinars, town halls, resources for members, national alliances. I'm most proud of those. We knew that we couldn't directly provide all the services, so we created national alliances that we were already building, but worked very strongly with first responder organizations, nursing associations, about 45 different nursing associations in the US, call centers where people might be calling in for services and helping people know how to respond, farmers organizations, parent, teacher, and school and family associations, manufacturing associations, and organizations like the National League of Mayors that were actually associations of policymakers. We used all of these alliances to distribute our resources and our webpage for materials. During COVID, our average webpage hits have been about 11 million hits per month, and about 45% of the traffic to the APA website has been global users. So we are very aware that the information we have needs to be good, needs to have high impact, and needs to get to as many people as possible. One of the initiatives that we've created at APA this year is called Equity Flattens the Curve. And it's a very strong statement that we find important. It's based on the notion that the COVID-19 pandemic affects everyone, but it is disproportionately harming the world's marginalized populations, including people of color, people with disabilities, people with low income, older people, and other groups who are vulnerable to bias. Unless we work together to mitigate these disparities, it will be more difficult to contain the pandemic. So I'm very pleased today to follow the High Commissioner for Human Rights, Michelle Bachelet, because we believe that our Equity Flattens the Curve initiative is all about human rights. Article 12 of the International Covenant of Economic, Social, and Cultural Rights focuses on the right to enjoy the highest attainable standard of physical and mental health. The APA will be providing a webinar through the American Association for the Advancement of Science's Science and Human Rights Coalition next month, featuring Maisa Akbar, one of our colleagues, one of the people that I have mentored. I'm so proud of her. She will be framing the disproportionate effects of COVID as a global human rights issue. Equity Flattening the Curve is an international initiative of the APA. Many international psychologists have already gotten involved, contributing their expertise to combating the disproportionate harms of COVID on marginalized groups. All of our expert working groups feature international participants. We have people from more than 20 countries that have participated in our recent webinars on how to flatten the curve and make health equity possible around COVID, including people from the Dominican Republic, Brazil, Mexico, and Colombia. We are also developing right now a racism policy, which an umbrella racism policy, which describes both the role and the needs for psychology's involvement in the eradication of racism. And we are putting under that umbrella policy, we're defining it as a global human rights issue. So Jennifer, my colleague, will have a lot more to say about health equity as she talks with you. I'm sure she's most passionate about that subject. Right now, what I'd like to do is very briefly show you a very short video, having now talked about our national efforts, that talks a little bit about some of our global efforts at APA this year.
Issues like climate change and the COVID-19 pandemic have made it clear that global challenges require unified global responses. We accomplish more when we work together. That's why APA is committed to working with our global partners to promote the use of psychological science to improve lives worldwide. APA has been in long-standing collaboration with the world's leaders in psychology and has joined leaders from approximately 70 associations from nearly every continent to form a global psychology leadership team. Some issues are too big for one association or one nation to tackle alone. APA has continued its work with global partners on addressing climate change. In November 2019, APA co-convened the International Summit on Psychology and Global Health, a leader in climate action, in Lisbon, Portugal. There, leaders from nearly 40 countries signed a proclamation and resolution formally agreeing to collaborate on climate action, elevating psychology's role in addressing the climate crisis on a global scale. We're also working with the world's leaders in psychology to shift the global perspective on mental health and mental illness to include well-being, and will continue working toward making psychological science and tools available to all. But the importance of our unique global collaboration really hit home when the world was struck with a global pandemic. As the world grapples with COVID-19, psychologists around the world have taken immediate and urgent actions to advocate for members and citizens, inform decision makers and policies, address the unique needs of frontline health workers, and disseminate resources to support human well-being more broadly. We meet twice a week to collaborate on psychology's global response to the pandemic, and immediately identified one critical effect of the pandemic where every country could come together: home-based violence. Psychological, physical, and sexual violence in the home has increased worldwide during the pandemic. To address this widespread and urgent issue, APA joined with 60 psychological associations from around the world to take global action against home-based violence during the pandemic. The task force collaborated on and agreed to an evidence-based, action-oriented resource for psychologists that has been translated into 19 languages. And each association is working to ensure their members have access to additional resources and information relevant to their communities and contexts. At APA, we know that collaborating across cultures
Oh God, I did that. Sorry.
and beyond boundaries is the way to make progress on the world's biggest issues. We are grateful to all our partners in the international psychology community, working together to embrace a global perspective and expand upon the astounding progress we've made in advancing and applying psychological science to make a positive impact on the world.
Okay, we truly appreciate our global alliances. Hang on a second here. I've lost my slide. Where's my slide? There we go.
When school isn't a place you have to be.
All right, hang on a
why not go to
second.
school where remote learning can be as remote as you want?
Right.
Like a Verbo.
Next up is Scout.
Hey, I'm here. So these are some plants I found hiking. Some wildflowers. Here we have a pine cone. And then don't quite
Well,
know.
Carlos, I'm having trouble here. Something has started that I can't stop here. Hang on a second.
Whatever kind of vacation
There we
your
go.
family
Come
needs
on.
right now, find it on Verbo.
Okay, I've learned many things this year, and working remotely is one of them. I guess I'm still, oh, come on, let's not do this, please. Hang on a second. There we go. Now, let me see if I can put this back together again. Thank you, and let's go to the next slide. Huh. All right. One of the things that I have learned is that I need to be prepared and be prepared in many different ways. So anyway, the important point here is that we are so grateful for the international collaborations we've had this year. For me, this has been an especially meaningful part of my APA presidency. We are so truly appreciative of all the efforts of our colleagues to learn from each other. As the video demonstrated, we had about 60 different organizations that worked together, meeting twice a week since April, to identify key issues to leverage psychological science in the world, to create a global voice for psychology, and to elevate psychology status to help all the different peoples of the world. You can see here on our map the stars of the different places for the Global Psychology Alliance, and we're very proud to have all of these members, and we were very well represented by the Americas. You can see here from our webpage that our Alliance members were shared with me a very meaningful experience. I think we all felt the same way. Our colleague Michael from Nigeria felt this as something that helped motivate him during the COVID crisis. Our colleague Mark from Ireland said that he felt he didn't have to have all the answers as a leader because he had all of us as colleagues in the world to share questions with. And our colleague Ricardo from Brazil talked about the power and importance and leverage that a connected, united psychology alliance could bring to the world. There were several things we did in this global alliance that were very significant. We issued a resource statement, an evidence-based resource statement that was targeted to psychologists all over the world as providers that dealt with action against home-based violence. And that included domestic violence, child abuse, human trafficking. We reached between 1 and 2 million providers in the world with the idea of trying to get providers to pay attention for the signs in their countries of the increasing home-based violence that we are indeed seeing across the world. We also developed a joint statement on the value of psychology, which was really important. We translated this. It was represented the statement of 62 psychological associations in 24 languages, including 2 indigenous languages. And the document addressed what is psychology and what do psychologists do, because many people and governments do not really know. Why do governments need psychology and psychologists? And what's unique about psychology and psychologists? The goal was to promote psychology in order to help the public and policymakers globally. So this was truly what I call a horizontal leadership experience. We shared resources as colleagues and associations. We shared our expertise and our expertise consultants. We learned from each other. We developed an open translation policy where we could share documents and resources from each other's associations while giving credit, but also having the ability to translate and contextually frame the appropriate parts of those documents for different cultures and countries. So we learned a lot about what it means to be good leaders in a very collaborative way. And I'm very proud of my colleagues and all of us for doing this. Last, what I'd like to leave you with today are a few lessons that I have learned in my role as APA president in a very unusual global year about COVID crisis. And I pass these on. Ironically, my leadership studies focus on leadership under uncertain conditions. How ironic it was that I would be APA president in a year like this. I have learned that some of the most important characteristics is that leaders stay steady, calm, and consistent. And by consistent, I mean trustworthy, and I mean doing what you say you're going to do, because in a crisis, people need to know what they can count on. Being realistically optimistic is what I call it, which is people need both hope when the things are uncertain, and they also need reality. And I think we have seen models worldwide of both leadership that has done that well and leadership that has not. We need to be transparent, authentic, and honest. And one lesson, of course, that was important for me was being mindful of my own shortcomings while trying to figure out how to best use my strengths. And last but certainly not least, demonstrating caring and understanding. And this is what I have learned for both myself and my colleagues. Putting a point on this, and I would start with the last box here first, box 5, and move my way backwards. I think it has been important to the success of leadership of my colleagues and myself at the APA to stay focused on the critical few. In other words, try to figure out what you can do and focus on that versus worrying about everything that you cannot do. Box point 4 would tell you you have to be a good learner and be curious. In increasing uncertainty and crisis, we should be asking more questions and engaging more diverse perspectives rather than resisting the urge to close down, to resist that urge, because we know from research that communities that are more diverse in natural disasters, for example, have more adaptability and more resilience. And it goes for any crisis. Being curious, open, and seeking diverse perspectives is really what will make us all stronger as psychology associations and countries. Demonstrating that I could hear bad news and cope with reality. I think for all of us, that's really hard. That doesn't mean that you like what is happening, but it means you create by modeling that hopefulness that we can do something with this. No matter how bad it gets, we will move forward. And talking plainly with people. I think in psychology, like any other science, we have technical terms. And what we need to give people in a crisis is very clear, plain talk. Talk that not just goes to the head, but talk that goes to the heart. And last and never least, putting your values up front and staying focused. I said to you already, every day I got up this year as APA president, I focused on what the mission values and our values, especially around diversity and inclusion, were, so that I could continue to go through my day figuring out what we could do. So putting, in essence, my leadership learnings this year is empathy, clear communications, and being realistically optimistic and focusing on what you can do are the things that I have learned as a leader, and a lot of which I have learned from my international colleagues. I think we also see some examples, for example, in New Zealand and Uruguay, of government leadership that has learned to address the COVID crisis. Lastly, APA has also learned a lot as an organization. We believe, and I believe, that APA has actually become a stronger organization as a result of the COVID-19 crisis. We are relying much, much more on multicultural psychology as a model of how the world works. And this is very, very important for the US, because the stronger we move, the longer we move away from traditional white Western-oriented foundations of psychology and better integrate multicultural psychology as our model, then we have built the foundation to support a very key shift in where we believe we need to go, which is to population health and global mental health models. Meaning that we will not just treat those with severe diagnoses, we will continue to do that, but that we understand that if we really want to create access and impact on mental health in the United States and in the world, we have to have a full range of individual and community interventions that can help people where they are during times of crisis. So last, I would say this: none of these things are possible without courage. And leadership in a crisis for me has taken a little bit of courage, and a lot of that courage I have gotten from my international colleagues. As Maya Angelou put it very nicely, we cannot practice any other virtue with consistency. We can't be kind, true, merciful, generous, or honest. You can talk about all of these things, but the degree of courage is critical because of the uncertainty that people face. So I really appreciate the opportunity to have addressed you today. Thank you, gracias, and indeed, todos somos familia. Thank you very much. And now I'd like to turn this over to my colleague, Jennifer Kelly. Whoops, there we go.
Hola, buenos dias. Thank you so much for allowing me the opportunity to be here today. I will just spend a little time introducing my presidential initiative for next year, which will be on health equity. I started thinking about this back in February of this year. It seems like it was so long ago. And started doing a deep dive into research about health equity because I'm a clinical health psychologist, as Carlos had mentioned. And so one of the things that I think about is just looking at health globally. And so I was start doing a deep dive in the research about this to have this as it's like my big audacious goal. And then, 1 month later, this thing called COVID-19 hit us, and it just health disparities just hit us in the face, not just in the United States, but globally as well. So, and I began to really take this seriously, and I always have, but even more so after this. And so I'm going to give you a snapshot about the initiative and health disparities and health equity, and you'll see more to come in the coming months. So according to the World Health Organization, health inequities are the differences in health status in the distribution of health resources between different population groups. And what we know is that they arise from the social conditions in which people are born, how we grow, how we live, how we work, and how we age. And we know that there can be some ways in which these health inequities can be addressed. And one of the ways is having the right mix of governmental policies. So what we see is that health inequities is really a global concern. So I want you to look at these two charts here. One is from 1990 and the other one is from 2010. They look almost identical. It's not a whole lot of difference between the two. And so, but what we're seeing is that this is looking at the top causes of the loss of productivity globally. And when you look at this, it's established that there's significant mental health needs and that they exist globally. So in fact, in terms of the global burden of disease, mental health is one of the top causes of loss of productivity within the world. Now, I'm going to give you a little bit of information about the scope of the problem globally. We've been spending a lot of time here talking about what happens in the United States, but this is a snapshot of what is happening globally. So we have approximately 30% of the population worldwide is affected by some form of a mental disorder, and about 14% of the global disease burden is attributed to the neuropsychiatric disorders, mostly depression, alcohol and substance abuse, and the serious mental illnesses. Now, this is a striking one, and that suicides account for about 1 million deaths annually. And, this is a number that's just, we have to do something about. So what we see is that these figures translate into hundreds of millions of people who are suffering from mental disorders globally. And you have 154 million that suffer from depression. You have 25 million suffering from schizophrenia and 91 from substance use disorders. Now, here's the thing. over 2/3 of those affected do not receive the care that they need. That's the thing that we have to address. Now, this chart here, this graph really looks at what we call the social determinants of health. And so these are the conditions in which people are born, in which they grow, live, work, and age. And you can see from the economic stability, whether or not you're working or not, can you pay your medical bills, your debt, your income, where you live, the neighborhood, and the physical environment, whether you have walking neighborhoods. And I can tell you, in the United States, we are notorious for not having walking neighborhoods. Education, how far you've gone in school, and especially early childhood education. Food, your access to food, and not just food, but the healthy options of food. The community in which you live and grow, is there support in your neighborhood? Do you have exposure to violence and trauma? And the healthcare system, whether or not your provider has cultural competence and the quality of care that you receive. Now, what you see that's throughout all of this is racism and discrimination. And these social determinants of health impact on the health outcomes, the mortality, your morbidity, your life expectancy, the health status, and functional limitations. So one of the things that we know is that the initiatives that we have and the strategies that will address health, they must also systematically incorporate mental health as part of the overall health. So the application of the human rights and the social justice frameworks in mental health definitely require that we put effort into addressing the underlying determinants of mental health problems. And that includes fair, equitable, and ethical distribution of the resources. Now, as I stated earlier, we knew that health disparities existed, but I can tell you that with COVID-19, and especially in the United States that I really know about, it just heightened health disparities, and it just kind of slapped us in the face, and we could not deny it. So when you look at this, this chart here, this graph, and what it does is it really shows the coronavirus deaths and cases and how it disproportionately affects Black Americans in most states. So you can look out on the right side, you'll see the cases of the coronavirus, and on the left side, you can see the deaths, and you can see the percentage that's more than proportional as you get into more of the colors. And you can see some of them just do not have the sufficient data. So the question is, why is it that this is taking such a toll on Black Americans? And I'm going all the way back to what we talked about, those social determinants of health. So number one is that bias plays a critical role in health inequity, and it just perpetuates those structural inequalities that we have. And it could be either explicit or it can be unconscious physician bias, and that impacts on whether a patient gets proper testing and the proper treatment. And I'm going to give you just a little story. So Sandy knows about this, but a couple of weeks ago, I had been going to Gulfport, Mississippi, which is the deep South, because my mother, who's now 89 years of age, is hospitalized. And I think that I was really, it was on my brain more because I've been dealing with health disparities, you know, where you live, your race, and all of that. And I tell you, I spent every night in her hospital room for 2 weeks because I wanted to make sure that she was going to be getting the adequate care and the treatment that she needed. And fortunately, I think it made a difference. One of my colleagues' partners is a physician, and he told me that he thought that the actions that I did helped to save her life. And I believe it's definitely related to health disparities. And so back to COVID-19. And one of the other things that we know is that Black Americans have a higher prevalence of health conditions that just set the stage for us to be more at risk of death from COVID-19. And they include things such as diabetes, high blood pressure, and heart disease. And African Americans and Latinos are more likely to work in occupations. They're more frontline workers, that there's more exposure to the virus. They also have to take more public transportation, and that increases the risk of exposure. And the minority and the low-income communities are more likely to experience food insecurity, substandard housing, high-density housing, and higher areas of higher air pollution, and it leads to higher rates of asthma and other diseases. And also, we know that there are healthcare deserts where there are not physicians and healthcare facilities within 5 miles of many of the people of color. Now, the other thing that we've been finding is that the COVID-19 has had a significant impact on the mental health of individuals, and the American Psychological Association, APA, just released the Health in America, the Stress in America survey, and is really showing an increase in the symptoms of depression and anxiety. And you can see this is from June, but we are seeing just the impact of this. So you have anxiety disorders increasing, that's increased by 31%. Stress-related disorders or trauma, 26%. The other thing to think about in the United States, so in addition to COVID-19, guess what else is happening that's even added to this? And this is what the Black Lives Matter movement, the trauma that we have been experiencing as Black Americans, seeing the systemic racism just rearing its ugly head with that as well. And so we're seeing more people use substances as a coping mechanism. And unfortunately, the other thing that we're seeing more of is that people are considering suicide more. And this just really shows more about how workers are reporting lower mental health since the outbreak began. So when you look at the left side is the mental health score 1 year leading to COVID-19, and then you're seeing what's happened since the outbreak. So in 1 year before, you see 45.6% felt that they were healthy and they had no challenges, and that number decreased to 21.4% since the outbreak. And then you see the ones that's feeling extremely challenged and non-functional went from 6.8% to 26.6%. So it is clear that we have some challenges that we have to address. So the environmental, social, and behavioral factors, these are all within psychology's expertise, and these contribute to health disparities in interacting ways. So what needs to happen is that psychology, we must position ourselves as a force for really achieving health equity and really eliminating the health disparities. So now I'm moving towards my initiative. And so one of the things that I know is that we have to work together, science, policy, education, and practice, to make a difference in terms of achieving health equity. So I have an APA Presidential Task Force on Psychology and Health Equity. So our first goal is to get our task force together. So I have two individuals that I am so proud of to serve as the co-chairs of this task force. And many of you know one of them is Jeffrey Reed, and he's worked with the WHO. He's a longtime friend and advocate of psychology. He's worked with APA, and so he is serving as one of the co-chairs, and the other co-chair is at Morehouse Medical School here in Atlanta, Georgia. And Morehouse is a Black medical school, and they focus on health equity. Her name is Keisha Holden. And so we are establishing the task force now that will consist of members with expertise in selected relevant areas, such as health disparities and working with different Black, Indigenous, people of color populations, look at the effects of built and social environment on health, psychological research on racism, because that threads throughout the health disparities, and public policy and advocacy. So once we have our task force together, which we're almost done in compiling, we're going to do an extensive review of the relevant research, community-based initiatives and policies, and then we're going to produce a comprehensive report that will articulate a vision for the role of psychology in achieving health equity. Now, the thing that's interesting about this is that there's a lot of research about health equity, health disparities, but we all see it from that public health framework. So and even though psychologists are doing it, they talk about it from the public health framework. So what is it that psychologists can bring to this table? So we're going to provide some specific recommendations that will promote innovative approaches that will incorporate psychological science, education and training, practice, public policy, and legislative advocacy. And then we will also have recommendations for the corresponding APA organizational units. Now, I believe that the review will indicate a need for a formal policy on psychology and health equity. And if that's the case, then we'll also develop a policy for approval by the APA Council of Representatives. Now, we're expected to end our work at the end of 2021, but that's not going to be hopefully the end of what we will be doing as it relates to health equity. So the goal is to pass this on over to this newly formed committee on health equity that APA has established, and they can continue this. But we're going to do a deep dive into this next year. And so we're getting started, and I want to thank you so much for this. So one of the things that we know is that we have to have education, science, practice, and public interest united if we're going to benefit society and improve people's lives. Thank you. Is there something that I need to do?
No, my dear Dr. Kelly, they haven't muted. I was muted and I didn't have the capacity to unmute myself. So I was gesturing for help, and somebody, a compassionate soul came through. Is the nuisances of working with a complex system. So wonderful. Thank you so much to both of you. Wonderful presentations. I can see how important is the idea of quote unquote working collaboratively. You both mentioned global initiatives. The High Commissioner also, highlighted the issue of working together, because it's one single spaceship called Earth, and we're all in it. So if we don't save it, I had lunch with a great astronomist from the university, and I asked him, so where do we go next? And he said to me, I've been working on this for about 30 years, and I have to tell you, work on climate change initiatives, because we haven't found any. This is it. So, and what do you know? We have an international initiative on climate change. So on that note, so help me understand, how do you envision the relationship with international organizations? And the reason I mention that is because our members sometimes, and I have the data for that, sometimes feel that we engage in a top-down relationship, where some international organizations invite collaboration in a way that says, oh, let me tell you, rather than let's talk and let's collaborate. So help me understand both of your views on this matter, because I know our members are interested in this issue.
Well, I can kick it off first. I think what we have to do, Carlos, is we have to look fundamentally at the way we work and the assumptions we make. So, for example, on the presidential task force that I have put together at APA on climate change, international climate change, we have put international members on the task force from day one. In fact, some members of our global alliance are actually sitting on our task force. So the way we conceptualize the issues, we will be having a convening meeting of that task force. And my opening remarks are going to start with two things. One, that this is a globally focused task force and that global climate change is a human rights issue. So the way we frame the problem is important. The second thing I'm going to be asking that group to do, as an example of what I'm talking about, is that I'm going to be asking them to use and figure out ways to use our Global Psychology Alliance for ongoing feedback, data, and interactive information as the task force works. I think what has happened, there's a lot of reasons why there have been top-down relationships in the past. But what we can do about those now is start from the beginning and working from a collaborative perspective and bringing mutual perspectives into the room as we're formulating the questions, not just waiting until we have answers. And I think that's a very narrow perspective that certainly we have had in the United States historically. And I think we're working very hard by how we work and when we incorporate and integrate our colleagues, with the assumption that you all help us formulate the questions, not that we have either the questions, all the questions, or certainly all the answers. And so if that helps as by example is how we can address that.
And may I add to what Sandy said, and as I was thinking about the initiative on health equity, I knew that it's a global issue. So that was one of the reasons why I selected Jeffrey Reed to serve as the co-chair of this, is because, you know, if there's anybody at APA who has such a global perspective, it would be him. The work that he's done with the WHO and that he continues to do. He's at Columbia University now and we're partnering with Mexico. And so I think that we're going to bring that as part of it, because it's not, we're not just one unit. We're, you know, it's globally and it's the world.
And if I might say, Carlos, I think the APA, certainly this APA president, I think her colleague, are very excited about the possibility of bringing the U.S. as a whole back to the global community.
Fantastic. Oh, by the way, I just noticed that it's 10 o'clock. We are on our time.
Yeah.
So I don't wanna stretch our luck and upset our colleagues from around the Americas and the world by going overtime. But I also noticed that the Flattening the Curve, an initiative that you mentioned, Dr. Schulman, has been very open and actually has embraced participation from people from all over the world. Yes. Into this initiative. So I have to say, from my personal experience, I have lived a renewed way of collaborating, and I listened very carefully to all of the presentations, and I remember clearly you saying, and Dr. Kelly mentioning similarly, lateral, the idea that we will work on a common plane, not in a quote unquote top-down type of approach, and I'm a personal beneficiary of that, knowing that you have both very heavy schedules, and yet you are here, you are participating, and you both agree on calling this todos somos familia. We're all family, meaning we need to work together. And the global initiatives are great. The Global Psychological Alliance, GPA, is another demonstration. So this to all my colleagues, members of SIP and others, friends and followers, we are living a renewed alliances around the world. Thank you so much, and to be continued.
Thank you. Thank you, Carlos,
Thank
and thank you, everybody. Thank you so much.
Muchas gracias. Thank you.